Hello, Alicia. Thank you so much for joining me today. And thank you so much for speaking at the NCH conference, our very first online conference that we're having in September. So this is just a short interview so that we can give our audience a flavour of what you're about. So maybe we could just start by you telling me how you got to the place in your career that you're at now.
Okay, first of all, I am so honored and happy to take part in your conference as a psychotherapist, integrative psychotherapist. I really respect and use hypnotic suggestions during my work, directly or indirectly. Now, I have been working with the cancer patients, mental health patients during last 20 years on the daily basis. I am a psycho-oncologist, clinical psychologist, but I have started as a young breath worker. When I was a young person, I found the book by Alexander Lowen, Spirituality of the Body. I was 15 at that time, and that was the moment when I decided what I am going to do with my life. Yeah.
Wow.
I realized that connection between body, breath and mind, this is the thing I really have to do for myself and later for others, for the other people. So that's how it started. And in Poland at the time, there was no internet, of course. And there was a limited number of books you could have read. But I started with the rebirthing breathwork groups, and I have met Arnold Mindell's process-oriented psychology, where I benefited a lot. And later I started psychology studies, and after completing my master's, I started to work at oncology clinic. This is a very large scientific research center with 600 beds. And it's been 20 years, so I have met a lot of sudden, horrible situations of confrontation with grief, with existential fear and a deep anxiety and panic. So as an integrative psychotherapist, I had training in body psychotherapy in France and in Poland. And I started with breathing practices, short breathing practices, which led people to the state of inner, let's say, focusing on inner awareness, on their inner process. So sometimes it was the conscious meditative process, or sometimes it was the hypnotic process leading to the change and cathartic reactions. And I am training with my patients day by day using breathwork practices, bodywork practices, and hypnotherapy all day long to relieve them from the pain, panic, inner horror of a cancer experience. Inner experience of cancer might be really horrible for the people. I'm also an old meditator with a Buddhist background. I started as a teen, so that helps me a lot not to be caught by, let's say, my subjective perspective. So I'm really happy being able to help the patients on the daily basis, training people, teaching them. On my way, I was very interested in neurobiology and psychoneuroimmunology, and now I have PhD in medical biology, which I have completed at my research hospital. That was possible. And I am working with a wonderful team of people, so skilled, so educated, and so compassionate. So this is really an honor. That's how it is.
It sounds challenging, but very rewarding work.
Yes, because we, as a therapist at oncology, I am somehow forced to act quickly. So without breath work, without focusing on inner experience and trance, I would be much less effective. Yeah.
Well, and it's so lovely to hear of that side of care being taken of cancer patients, because I don't know if it's maybe different over there, but often here you don't get that type of assistance with the mental and emotional side of well-being, which I'm sure is invaluable.
Psychotherapists are not everywhere. Let's say we have too little people everywhere helping at the hospices or at cancer clinics. But I believe people do their best. The mix of, let's say, the integration of body psychotherapies and hypnosis I use. This is my, let's say, personal choice, where my soul of the therapist was led to this certain way of intervention where I do not have the strict contract. I do not work for long. I adjust to the state of the patient. I follow the patient where I can, if procedures are too traumatic, like the magnetic resonance or radiotherapy with a mask when the patient has claustrophobia. So to relieve the patient quickly from claustrophobic or panic reaction, I use breathwork, followed by, let's say, therapeutic alliance. And it's almost always based on hypnotic trance, because I do not have time for, let's say, cognitive working on the subjective patterns of experience.
And what's so wonderful about breathwork is that once someone comes to understand it, then they can take it wherever they go. They don't need to take you with them.
Yes, and the world has changed, and we have applications on the smartphones where they can count their breathing. They can breathe rhythmically in a coherent way, 6 breaths per minute. They can breathe slowly to calm down their nervous system and to activate parasympathetic part of the nervous system. The patients may breathe intensely to activate the immune system and the sympathetic part of vegetative nervous system that leads to mobilization, because I do believe the patient, somatically ill patients, should not be immobilized by relaxation totally. We need a certain balance between relaxation and mobilization. So every intervention counts.
Sounds wonderful. So leading us into what are you going to be covering at the NCH conference for us? Don't give too much away, but just a taster of what you're going to give our audience.
I will be very happy to present the breathwork practice integrated into the practice of every possible psychotherapeutic modality. Because the breathwork process might be totally technical and behavioral, might be cognitive, might be aware and meditative, mindfulness-like, and might be cathartic, emotive, expressive, and might be trance-like. So everyone may use breathwork to enhance their effectiveness at the battlefield, let's say. And I will describe several cases on how to treat quickly claustrophobia, panic disorder, PTSD, and probably much more, because I work with the patients on a daily basis, so I could just describe last 3 days. Yeah,
I'm sure.
Yes, and it will be shown in the context of polyvagal theory that helps us to really understand what are we doing with our body, with our breathing, and with our vagal nerve. Yeah. So this is the context I am going to show it in, and that gives you everyone nice psychosomatic insight without too much theory or too much molecules and receptors. I do love neurobiology of catharsis and breathing, but that is quite complicated. And polyvagal theory gives us complex but simple understanding.
Yeah, makes it accessible.
Yes.
Which is brilliant. That's what's so great. I think a lot of this breath work and, like you said, the polyvagal theory is stepping more into the mainstream. People are hearing a bit more and wanting to understand more about it, which is really exciting.
Yes, I'm so happy there's a lot of research on breathwork now. When I was starting my breathwork practice as a 21-year-old person, there was almost no research. My master thesis was one of the few in the world. And I knew that something was working in the way it was working. For example, slowing down breathing gives the effect different than conscious connected breathing or cathartic rhythms. But it was working like a sort of a witch hidden between, let's say, mainstream professionals. So this is the long way of showing the people who have no education in psychotherapy at all how breathwork may work and how
Yeah.
they can help themselves in recovering, getting better. And also medical staff may benefit a lot. Getting distance, getting freedom of mind without, personal emotional perspective, which might really disrupt therapeutic and medical alliance between the patient and the doctor. So it's been a long, interesting way.
And you're still practicing it yourself?
Yes, daily. During the pandemic, I have started Wim Hof method course and Buteiko method course. They seem to be quite opposite methods, but invaluable, completely precious for the practitioners. So I am now an avid Wim Hof method practitioner with ice bathing and breathing intensely. Maybe, and I'm going to get certificates in both of these modalities, let's say, to make my knowledge formal.
Yeah.
Yeah.
Do you actually have an ice bath yourself?
Yes, I'm practicing ice bath when I can. I do it nearby. We have a silver mine, and we can have an ice bath all year long in our silver mine. It's 20 kilometers from my town. Mountains are close to me. I'm just waiting for the autumn season because water will be colder every day. So I'm practicing it because the connection between the cold and intense breath work gives immediate pain and inflammation release in the body. So it's very helpful for some of my patients and for me.
That's brilliant.
Yeah.
Well, thank you so much for chatting to me today. You've given us a really good flavour of what's to come, and it sounds really insightful and exciting. And I think it'll be really, really useful to the audience at our conference. So thank you so much for joining me, and thank you so much for coming to our conference, and I can't wait to hear you speak.
I'm so happy I will be with you at the conference. Really wonderful to join you, and I'm so happy to be invited.